a little bit about HIV and some of the medications that you can take if you are protecting yourself against the virus or if you're living with the virus. So first and foremost, human immunodeficiency virus, commonly known as HIV, is a virus that attacks a person's immune system and makes them more vulnerable to disease, including acquired immunodeficiency syndrome, also known as AIDS. HIV spreads through contact with bodily fluids, like blood, semen, vaginal fluids, and rectal fluids. And as such, it's most commonly spread through sex. But it can also be spread through intravenous drug use, aka using needles or syringes to inject your body with substances. HIV tends to cause flu-like symptoms about 2 to 4 weeks after exposure to the virus, but sometimes causes no symptoms at all. The only way to know for sure if you have the virus, especially if you're concerned you've been exposed to it, is to get tested. Thankfully, modern medicine and science have created several medications to allow people to protect themselves from contracting HIV or to live long and healthy lives if they have an HIV-positive diagnosis. So first, let's talk about prevention and protection against HIV. PrEP is pre-exposure prophylaxis, and this is a medicine designed to help reduce a person's risk of contracting HIV, and this can be taken in a pill form every day or in a shot form every 2 months. PrEP is specifically designed for people who are not HIV positive, and it is only designed to reduce the risk of HIV, not another sexually transmitted infection or disease. It has about a 99% effectiveness rate in pill form and about 74% effective in reducing risk when it's in the shot form. PrEP cannot guarantee that you'll never get HIV, but it can make you less susceptible and give you a peace of mind. There are several groups of people who may qualify to get on PrEP, and you can always reference hiv.gov or go to your provider if you need a reminder. Ask your provider about PrEP if you have had anal or vaginal sex in the past 6 months, if your partner is HIV positive or maybe you're not sure about their status, and if you haven't been consistently using protection like condoms or dental dams when engaging in sex. You should also ask about PrEP if you've been diagnosed with an STD in the past 6 months, if you inject drugs, especially if you are sharing needles, syringes, or other injections equipment, and definitely if you're sharing this equipment with somebody who is HIV positive, or if you've previously been exposed to HIV and taken HIV-related medicine, like post-exposure prophylaxis, which we'll talk about in a second, and continue to engage in sex that may not be safe or protected, like not using condoms or dental dams. To get on PrEP, all you have to do is talk to your medical provider about the medication to see if it's a good and appropriate fit for you. Luckily, PrEP is a protected medication under the Affordable Care Act, so it should be covered under almost all insurances and Medicaid. Even when taking PrEP, though, you should engage in safe sex practices like using that condom or that dental dam and getting tested regularly. In addition, open communication about your status or your partner's HIV status can help you stay on top of risk and also make sex safer and more enjoyable for you both. Now, a second ago, I did mention post-exposure prophylaxis, so let's talk about that. If you think you've been exposed to HIV with your regular sexual partners or have recently been assaulted, contact your medical provider or your nearest urgent and emergency care clinics and ask about post-exposure prophylaxis. PEP is a medication designed to reduce the risk of HIV developing after you are exposed to the virus, even if you aren't sure if the other person has HIV. You should start this medication ideally within 24 hours of exposure, but at a maximum within 3 days or 72 hours. This is an emergency medication. It is not designed to be taken regularly like PrEP is. If you are consistently exposed to HIV or engaging in unprotected sex, you should ask about pre-exposure prophylaxis, not post-exposure. If you are prescribed post-exposure or PEP, you will take it for 28 days and get tested for HIV during and after those 28 days. Your provider will let you know when to come in for a test and how often. Like PrEP, this medicine should be covered under most insurances and Medicaid. Now, you can take this medicine if pregnant or breastfeeding, but make sure you talk to your doctor about this to see if it's the safe and right choice for you and your child. Now, we've covered staying protected from HIV. What if you already have the virus? What if you're diagnosed HIV positive? Well, if you are HIV positive, neither PrEP nor PEP are the medicine for you. However, you should ask your provider about antiretroviral therapy or ART. ART is a medication for HIV positive individuals to reduce their viral load. Viral load is essentially how much of a virus you have in your body. When taking ART, this medicine reduces the viral load of HIV, which makes you less likely to transmit it to somebody else. With ART, you can reduce your viral load so low that the virus is undetectable. Now, this doesn't mean that you no longer have HIV. It just means that your body and the medicine are doing a really good job at keeping you as healthy as you can be while still being HIV positive. ART increases life expectancy, improves quality of life, and reduces the transmission of HIV. It is not a cure. Now, ART, like PrEP, comes in pill and shot form, and you should talk with your provider to see which form fits you and your needs best. It's crucial that you take your medicine on time and regularly if you want the most effective results. And remember, ART is not a cure, so you should always practice safe sex, get tested regularly, adhere to your medication routine, and talk with your partners about your status so they can protect themselves as well. So that was a lot of information. As a brief reminder, HIV makes you more likely to get sick, and you can get HIV through bodily fluids, like through sex or through shared needles. You can prevent HIV by taking pre-exposure prophylaxis. If you think you've been exposed, ask about post-exposure prophylaxis. If you already have HIV, ask your doctor about antiretroviral therapy. Now, even with all of these medicines, you should still be using condoms and dental dams and having protected sex, talking with your partners about your and their status, and as part of your routine or when in doubt, getting tested. Now, I'll let you in on a little secret, by the way. You can test for HIV in the comfort of your own home. We have a couple other videos about test kits at home that you should go check out to get more information about this. Now, I've covered all the basics about HIV and the available types of medicine to keep you safe and healthy. And you can always check hiv.gov, the CDC, or ask your provider if you need a reminder about this information. Also, don't forget to check out the Empower Lab website for more about your health, including your mental health, like finding the right therapist, talking to kids about racism, and coping with racial trauma. Thank you so much. Bye.